I feel very fortunate for my family's response to the situation, as well as just, I guess, physical location of where I was at the time.
A cancer physician at Munson Medical Center is thankful to be where she is today. Dr. Yelena Kier moved to Traverse City with her family 2 years ago to work at Munson Medical Center. But she grew up in Russia and at the age of 3 experienced the world's worst nuclear disaster.
Tonight she's sharing what she remembers and explains how she applies it to her practice today. 9 and 10's Caroline Powers and photojournalist Jeremy Erickson have more in this special report, the Chernobyl experience.
How are you? Good.
Dr. Yelena Kier knew she wanted to go into the medical field since early high school.
As a child, as a small child, that helping people was just the greatest thing in the world. And as I grew older, I realized that the one, or the best way, in my opinion, to help people is to be a physician.
For the past 2 years, she's been treating patients at Munson Medical Center.
Well, have a seat. I'm gonna lift you up a little bit.
From anemia to lymphomas and leukemias, working in hematology oncology is what she loves.
Just grateful and humbled. I am humbled by my patients every day, and I'm grateful for the ability to be here.
That feeling of gratefulness comes after Dr. Kier was exposed to the world's worst nuclear disaster. Dr. Kier grew up in Tula, a city in Russia. But on April 28, 1986, she was less than 50 miles away from Chernobyl.
There was no information that was really given. I think there was a lot of fear and panic because no one really knew what was going on. There was an increased military presence with military trucks and personnel in the area, and they were hosing down trucks and maybe even people with water.
Dr. Kier's family decided to drive back to Russia.
All I remember is that when I came home, since my family, most of them were electrical engineers, we had a Geiger counter at home. And my mom told me that when she held it over myself as well as my clothes, it went off. So a lot of the things that I had were highly radioactive and had to be destroyed.
While Dr. Kier was only 3 years old when the Chernobyl disaster occurred, she uses what she remembers and has learned about the experience.
I can imagine how frightening it was for adults to not have information, to not know what's happening, and just to be scared for themselves, their children, their families. I've taken that and I've tried to translate that to my practice of oncology. Because when patients come in here, so many times they just received a devastating diagnosis and they're scared and they want answers, and they really just want someone to hold their hand and show them the path that will benefit them the most.
From growing up in Russia to living on the East Coast and studying medicine in several different states, Dr. Kier's patients say they are thankful her journey has brought her here to Munson Medical Center.
So we'll scan as we need to. You have no symptoms. You saw the ENT. The PET scan looked great.
She's your support person. Like I say, you hold on, you grab, you cry, and then you do your examinations and that.
Dr. Kier's main focus is on her patients' health, but she's also making sure she doesn't become another health statistic of the Chernobyl disaster.
I myself had a thyroidectomy several years ago because of the frequent screenings were getting too much. It was too much with the worry and the concern, and every time, the phone rings and you have this fear of what's going to happen.
Have more appreciation for other people and their life experiences and what they've gone through. What goes into making them who they are? What have they lived through?
I'll see you back in a few months. I don't know what my patients go through, but I hope that I can relate to them on some small level.
For 9 and 10 News, I'm Caroline Powers.